911 emergency.
Hey, there's been an accident. I need help right away. If there's a school bus and another van, there's all kinds of people everywhere. The bus is starting to smoke, so you guys gotta hurry up and get there.
Okay, are there people trapped?
The bus looks like it's full.
Sir, I have people en route to you. How many people are hurt? Do you know?
I don't know. I can't tell. I can't get in there to it. There's all kinds of, they're screaming for help. There's all kinds of people inside that bus.
When there is an emergency on the ground, early activation of air medical resources can save lives.
Hey, this is Dad. Can we get Mayo 1?
If all criteria for dispatching an air ambulance are satisfied, Mayo 1 helicopters will respond.
Mayo 1 will be departing en route to Chaffin. We'll be at 2,000 feet. I'll estimate about 10 minutes en route. We can take coordinates here from you shortly.
An accident scene with injuries often means chaos. Situations that require training, planning, speed, and skill from responders. One of those skills includes making sure that the dispatched helicopter lands safely. Besides establishing radio contact, the GPS coordinates should be provided to the pilot. While Mayo 1 crew travels by air, preparations should be happening on the ground. For instance, there may be a pre-designated landing zone that gives the pilot a known reference, and a landing zone coordinator should be assigned to the ground crew. The landing zone coordinator is responsible for identifying a safe landing zone, one that's clear of hazards.
And then we have a fence to the east, to the north.
Such as signs, trees, power lines, and other obstacles. These features may be obvious to those on the ground, but from the air, they may not be visible to the pilot or aircrew, especially at night. Additionally, the pilot's view below the helicopter is limited, so they won't see anything directly below or behind them. For this reason, communication between the pilot and crew and the landing zone coordinator is imperative. The secure areas should measure at least 100 by 100 feet. In addition to the landing zone, the coordinator should look for obstacles 300 feet out in each direction of the anticipated approach and takeoff path. Other features of a safe landing zone include areas that are relatively flat and solid. Loose sand, dirt, and snow are stirred up by the rotors, which compromise visibility. Wind direction is an important consideration. Helicopters need to land and take off into the wind. A landing zone coordinator should stand with their back to the wind, which indicates the wind direction to the pilot. Once the zone's identified, and it's possible to do so, emergency vehicles or signal lights should be used to mark the area. Don't use cones as markers, as they're too lightweight and could become projectiles. Using emergency vehicles as markers is especially helpful at night. Mayo 1 pilots and personnel wear night vision goggles that magnify light up to 40,000 times. For that reason, high-beam headlights, spotlights, or flares should not be used during nighttime landings or takeoffs. Flashing lights can be distracting, so light bars should not be activated. A safe landing zone is only part of a good protocol with air medical transport. The area must be kept secure. Rotors are loud, so prior communication that assigns a tail rotor guard is essential. The rear rotor of the helicopter rotates quickly, at about 2,500 RPM, so fast that the tail rotor is practically invisible and powerful enough to slice through a 3-inch tree limb. Because of the noise and turmoil at an emergency scene, the tail rotor guard's job is critical to safety. The guard stands 50 feet behind the tail and permits zero traffic, from personnel or vehicles, to pass through.
I had to have you step back here. I know. We got to have you step back here. We got the landing zone.
Besides the usual hazards, power lines, posts, poles, and trees, drones are becoming an increasing threat to the air medical operation. As consumer sales and use of drones increases, so does the potential risks to helicopter safety. Drones are hard for a pilot to see and can be deadly if they impact the aircraft. The pilot should be immediately notified if there's a drone seen in the area. Air ambulances have an excellent record of safety, but in a worst-case scenario, those rescuers may need rescuing themselves. Here are the things responders need to know. Don't approach the aircraft until the rotor blades have completely stopped. If the crew is incapacitated and the engines are still on, they will need to be shut off for the rotors to stop. In that situation, only approach under the blades if it can be done safely. Open either of the front doors to access the cockpit. Locate the two buttons outlined in red at the top center of the main console. Push each button once and wait. The engines will stop in 15 to 20 seconds. It may take another minute for the rotor blades to come to a complete stop. Once they have, attend to the crew and patience as necessary. The handles of the emergency exits are clearly marked with orange paint. These are the first points of entry responders should try. If the rescue crews need to cut into the helicopter to free the crew, do not operate saws in these areas. The fuel lines that run vertically. The tanks underneath the helicopter. Additionally, oxygen and biohazards are typically on board, meaning that responders need to exercise care and caution in a helicopter rescue situation.
Mayo 1 will be departing the scene. We'll be lifting with 3 souls. We've got about 130 on fuel. We'll be at or below 2,000 feet.
The cooperation between ground crews and air crews during emergency maximizes the potential to save lives, something all responders have committed their lives to.
St. Mary's Mayo 1 on Rome.